Good morning, everyone. Yes, thank you very much, Musa, for this introduction of myself. Once again, my name is Dr. Nsubuga, John Bosco, and I'm the director at Entebbe Regional Referral Hospital. And I would like to welcome all of you here, all protocols observed, colleagues from Ministry of Health, all the different partners and the different individuals who have managed to spare time to be with us today for this national dialogue on eye health. Especially, I like the way that it is focusing a lot on some vulnerable groups, now especially the children. I'm coming from a regional referral hospital, which is Entebbe Regional Referral Hospital. It's one of the different regional referral hospitals we have in the country. And with this, some of the services we provide among the clinical services are the eye care services. And for a long time, we have been partnering with Light for the World, because at Entebbe we host the National Optics Center, but then we have been partnering with Light for the World for several years to make sure that eye care services, not only for the patients in Entebbe, but patients all over the country can get good quality care. And for this, we do a lot of, we provide a lot of curative services. We are involved in the training of staff in eye care, but then we conduct a lot of community engagements related to eye health. We go to communities, to hospital, to lower health centers, to schools, and also to the communities where we involve VHTs in screening for these eye conditions. One, I like that we are having this particular dialogue. Many times when you look at the health care services that we provide, we tend to pay a lot of attention to some particular services. Many times if I have HIV, I know where to get care. If I'm a pregnant woman, I know where to get care. If I need some of these general surgery issues, I know where to get care. But then when it comes to particular services like eye care, ENT, some of these special services, sometimes as I can imagine in the community, people struggle to know where they can get these services. Actually, you will find that when you ask someone in the community where they can get these services, they may mention about 2 or 3 places. But for the other services, people will know where they can get the services. So having this kind of dialogue that we are having today, for me, I'm looking at it in a way of also creating awareness for eye health services, such that the more people get to know of these services, to know that actually when you have some eye discharge, because some of these eye conditions we are talking of, visual impairment, in whatever form it may come, you may find that it may start as a small itching, simple itching that people may have. And for all of this, it can start as a small discharge itching, but for all of this, sometimes for this care, it may only need someone to go to the nearest health facility to get the care that they need. At a health center 2, at a health center 3, eye care, you can get it in these places. However, sometimes in our communities, people can have these conditions, they don't seek care, and they only think that you have to come to Kampala to a regional referral hospital to access this kind of care. So in fora like this, we would like to sensitize our people that sure, eye services are very, very close to them. The place where they go for their malaria treatment, the facilities where they go for immunization is the same facilities that they can get care for their eyes. In Uganda, we have what we call the Uganda Minimum Health Care Package. It has several clusters in it, but one of the important clusters has to do with eye health. So in this way, government has tried and is providing these services. Sure, at a lower level, you may not find a specialist for eye care. You may not get glasses at a health center too. You may not get specialized services, but sure, you can get some form of care from which probably if it is a bit severe, then you can you can be referred to the appropriate place. Now, coming and in Uganda, impairment, the prevalence of eye conditions actually is much. And we are talking of about 0.4% of the population experiencing some form of blindness, and then about 15.5% experiencing some visual impairment. And I like what Musa has just demonstrated here when he told us to look at our phones. So most of us thought we are looking at our screens, but actually, the phones, but actually we are looking at the screen guard. So you can see the level of visual impairment that we may all be having. But for some of this, as I said, the causes can easily be prevented. So we are putting a lot of emphasis on issues of prevention. And I like the program that Light for the World is having, the one of screening, going to the community to make sure that anyone with this kind of problems is screened before actually they develop serious complications. But then after screening, then we would like that those who have the conditions, they are treated. And sometimes some people may deserve to have rehabilitative services if they have had severe eye conditions. So in this, I would like to thank Light for the World for all that they have done. And as you know, to handle all these issues, it requires a lot of resources. And as you know, government may not be in a position to provide all the services that are required. So the need for partnerships, building partnerships is very important. And I'm glad to say I've been seated with Dr. Wani here, Anthony, and he has told me he's from Sight Savers. And I know Sight Savers is also doing a lot in relation to this kind of work. And many of you who are coming from, who are doing what is possible within your means, either as a journalist, either as a church leader, whatever. All this is really appreciated. For us who are in hospitals, who are supervising health systems from regional referral to down, it becomes our responsibility to make sure that this is properly done. Finally, what I would like to emphasize on is the issue of eye health in the villages, in rural areas. Colleagues, these are when you go to the villages, whereas you may find that there are health centers in these places, but the community and maybe also the health workers, they are not yet very much sensitized in that way. Part of this is our role as leaders of some government institutions, but then as I said, we are partners in this, also for all of us to see that we sensitize the people in the villages. Last weekend, I was in Arua. I went to Arua, Yumbe places, and I went to Bidi resettlement. I think some of you may know where this place is a refugee camp. And good enough, in this place, they have a health center which offers, they try to offer a comprehensive kind of service. And I was glad to see, because in this place, people are having an ophthalmic clinic officer, they have an orthopedic clinic officer. They try to provide all these different services. So I'm only asking that as we plan for these conditions, for this care, we remember to plan for some of these vulnerable groups. It is so easy sometimes to forget them. But then I also like the issue of the children. You know, as Musa has said, I think he only became aware of the visual impairment, if I picked you right, when you're about 5 years, isn't it? In the P5. So you can see all this other time that he wasn't aware all of this. So children, in a way, they suffer a lot. They don't know if they have this impairment, and you find that their lives, they have these impairments. They can't move forward in their lives just because someone hasn't paid a lot of attention. In some cases, of course, some blindness, visual impairment rather, maybe is a too peak. But then there are others where a child is in class, they are performing poorly, and no one has identified that actually this child should not sit behind in class, they should actually be sitting in front. Or maybe they don't have, they need glasses. They are having maybe some refractive errors here and there. So screening, picking out the group of children as picking out children as a vulnerable group is also something I want to commend. So to all of us, I would like to thank you all for coming, sparing your time to be with us for this breakfast dialogue. Thank you so much, and I would like to thank you for listening to me. Thanks.